Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, where I will discuss what exactly bipolar disorder is as well as its causes, symptoms, and management. Bipolar disorder, which is also known as manic depression, is a mental health disorder that causes extreme mood fluctuations in an individual. Breaking down the word itself can help you more easily remember the two components of the condition. Patients with bipolar disorder experience moods that are on the complete opposite ends of the spectrum, one which is mania and the other which is depression. According to the National Institute of Mental Health, approximately 2.8% of the adult population in the United States suffer from bipolar disorder, of which men and women seem to be equally affected by the condition. The average age of onset of bipolar disorder is around 25 years old. There are three primary types of bipolar disorder, which are bipolar 1, bipolar 2, and cyclothymic disorder. Bipolar 1 is the most common of the three, and in order to be diagnosed, at least one manic episode must be present, and this manic episode needs to last at least a week. Depression may be present in bipolar 1. However, it is not necessary for diagnosis. In bipolar 2, the manic episodes that are present are not as severe as in bipolar 1, and therefore it is known as hypomania. In cyclothymia, there are alternating episodes of hypomania and depression that are present for at least 2 years. However, the episodes are not severe enough to be classified as either bipolar 1 or bipolar 2, which is why it has its own diagnosis in the DSM-5. Although there isn't just one risk factor or cause for bipolar disorder, it is thought to be due to a combination of genetics and environmental factors. There is some research that points to there being a genetic component to bipolar, and individuals who have a parent or sibling with bipolar are at an increased chance of developing bipolar disorder themselves. Also, in some situations, stressful life events can trigger the onset of bipolar disorder. Next, I want to discuss the symptoms of bipolar. I will largely focus on mania symptoms in this video since I already did an entire video dedicated to depression and its common manifestations. I will link the video below in the description box in case anyone is interested in watching it. The manifestations of mania can be remembered by the mnemonic DIG FAST, which stands for distractibility, impulsivity, grandiosity, or in other words, inflated sense of self, flight of ideas, increase in activity or energy levels, decreased need for sleep, and excessive talkativeness and rapid speech. These symptoms generally interfere with the patient's everyday life and affect different spheres such as relationships, career, and home life. Individuals with bipolar disorder may also experience psychotic symptoms, such as hallucinations or delusions. Hey, your friendly neighborhood doc, just checking in. If you feel that you may be experiencing any of the symptoms described in today's video, please speak with your doctor or licensed mental health professional. Bipolar disorder increases the risk of having other conditions, and some of the ones that I will mention can affect and exacerbate the symptoms of bipolar disorder. Some of the comorbidities that may be experienced in patients with bipolar disorder include ADHD, anxiety, and PTSD. Substance use disorder has also been seen in patients with bipolar disorder. Approximately 60% of patients with bipolar 1 also have coexisting substance use disorder. I'll finish up by talking about treatment for bipolar disorder. The mainstay treatments for bipolar disorder are medications and psychotherapy. Some of the main drug classes that are typically prescribed for bipolar disorder are mood stabilizers, antipsychotics, anxiolytics or anti-anxiety medications, and antidepressants. Something very important to keep in mind here is the use of antidepressants. A patient may present with what seems like depression symptoms, and if they are prescribed antidepressants, it can result in a manic episode or worsen mania that is already present in the patient. That's all from me today, but if you're enjoying this type of educational content, be sure to like and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop them down below in the comments, and I'll try to make a video on it. Here is another video I thought you might like and my latest upload in case you missed it. Until next time, bye.